by creating a system of incentives that rewards them generously for their sacrifices and commitment to saving and nurturing lives. Furthermore, we shall begin immediately to address the challenge of poor facilities in our health institution through steady investment in the acquisition of modern medical equipment, appropriate funding, and a robust system of partnership with well-meaning development partners. We shall see to it that access to health services is improved for all classes of Abians, and where necessary, we shall make important recruitments to address personnel shortages. Well, that's a quote from Governor Alex Otti on the day he was sworn in on May 29, 2023. And it's almost a year. We'll look at what has happened vis-a-vis what he promised Abians. My name is Ginika Oluwaha. Welcome. Well, my guest is already in the studio. I'm sure you know her. She has been here, almost a regular. And I'm talking about the Honorable Commissioner for Health in Abia State, Dr. Ngozi Okoronkwo. Good morning, Honorable Commissioner. Thank you so much for coming on the show.
Good morning, Ginika. Thank you for having me.
All right, welcome. I think we should just start with some of the promises made by Governor Alex Otti, which you have over time reiterated and said that the government must pursue those policies, and promises made to Abians where it affects the health sector. Let's look at the last time we were here. We talked about the issue of 3 hospitals that will be sited in 3 senatorial zones. Can we now have the names of those hospitals? Are they now ready? And where are the locations of these hospitals? Honorable Commissioner.
Yes, Ginika, just like we said, and I reiterated the last time I was here, we have kept to that promise that we made to the Abia people. We have Amacha is already on board, and it's been working since October last year.
Okay. And
also we have the diagnostic center, the specialist/diagnosis center on Aba Road, and it's fully functional. We have the Cottage Hospital Aba, and it's almost ready. We are just doing landscaping and we didn't envisage what we met on ground. That's actually delayed the work a little bit. We thought it would have been much easier to just quickly retrofit, but we had to take off the entire roof, and it looks like a new building. If you have visited the place prior to this time, and if you go back there, you see the difference. So that's actually delayed the work a little bit. But like I said, we are landscaping, we are wiring and all of that. So in a couple of weeks, we should be reopening the Cottage Hospital once again. The same goes for Omonato. Omonato also, as at last year November, we started. We went to sites to assess the building for retrofitting, but when the roof was taken off, the building almost collapsed. It was built in the 50s from the information I got, and of course it has been there for so long and without much maintenance. So we had to bring the entire building down. So now we are building from scratch, and the buildings are going up, and it's that's kind of delayed that. So, but we are determined. But we have an additional facility. The Okwalangwa General Hospital has also come on board, and it's we are currently retrofitting the administrative stroke facility area, the male and the female wards, and they look so amazing. You can also stop by to have a look, and it should be ready in a couple of months. We should be ready to go inaugurate, and and if you go back to the structures we are putting up, you'll see a very common approach to it, which was never there before. the landing areas, just the thoughts that have gone through into this. So we're not just retrofitting; we are thinking things through while at it, and we are trying to make sure we are meeting up with in a certain type of standard that's acceptable globally. So we're on track. We're moving, and Abias will be very, very. And we are not giving you structures that will not stand the test of time.
Okay.
So that's why we are taking our time to do them.
Okay, so Diumonnato General Hospital, which you said you started from the scratch, when are we looking at? What time? What's the time frame when it will be completed and probably commissioned? Is the governor going to? Is it one of the projects the governor is going to commission on his 1-year anniversary?
No, it's not. It's not going to be featured in this period.
Okay.
It should be ready maybe in another 3 months.
Okay.
It should be inaugurating in 3 months.
Okay, so there has been issues about the rehabilitation of these health facilities, especially where it affects the costs. Can you put your fingers to how much all this rehabilitation costs? These health facilities, like the Diumonnato General Hospital, which you started from the scratch. So, can you say this is the amount we are putting in for this facility to come on board? And the one you talked at Upualangwa, and there's so many other ones you're doing.
So we are taking them in batches.
Okay.
If you go to, for instance, if you go to FMC, you see buildings go up every day, and the hospital didn't close down while those buildings were going up. So we don't want to shut the entire hospital down by making sure we do everything at the same time. So we're taking them in batches. So these releases are coming to us in batches. So you may see a certain amount of money in the budget does not mean they have all been released at the same time. So we're receiving them in batches. So as we go, we take the buildings that we need at that particular point in time to make sure we get the hospitals back on track and they are functioning. Then we'll continue to increase the renovation as we go.
Okay, so maybe when you are done,
yes, then we'll be able to come back
with
to
the
you.
cost.
Yes,
okay,
yes.
so we will be expecting, and I'm sure Abians will also be expectant of that.
Definitely.
Okay, so moving on the show, let's look at the Abia State Multi-Specialist Hospital, built by the previous administration of former Governor Ngozi Okoronkwo. I learned that place has been under lock and key. The previous administration said they brought in so many high quality medical equipment, they installed it there, but up to this moment that place is not in use. I recall that he said they have, I think, structural issues and all that. So have you been able to fix it, or what is exactly happening with that facility? Because it's Abian's money that is that they use in acquiring those medical equipment.
Very correct, Ginika. I'm more interested in getting, giving access to health for the Abia people than playing politics.
Okay.
But I would not do that if I believe that it would jeopardize the lives of the people. So a lot of people have gone there to assess that building. The structure was badly built.
Okay. And
the ventilation looks very bad, and we are working assiduously to ensure that the place is ready, at least good enough to house the hospital. We have sent people there to, like I think 2 weeks ago, a week ago, to have the electricals done, because these things were done in a hurry. If you recall, this hospital was inaugurated night before the inauguration. Yeah, so everything was done in a hurry, and at some point I met up with the people that did some of the work, and they told me how quickly it was done and how difficult it was, and they couldn't even trust that it was going to stand the test of time because of how it was rushed. So there's a need for us to pay attention to all of that to make sure we don't jeopardize the lives of Abians. So we should be going in there in a couple of weeks. We are working to make sure the electricals are fixed.
Okay.
And some of the rooms, didn't have windows.
Okay. Yeah.
So we would have that done, and just sort of increase the ventilation. You don't want to go in there with a headache and leave with a bad flu, or you go in there with something and pick up another thing because of the ventilation of the place. So we are more in a hurry to get in there than you can imagine. So we are not abandoning it, but we are making sure that the place is fit for purpose.
Okay, so
because it was not initially built for a hospital, and you could see it. Like if you walk in, there was, the functionalities could really tell you that it wasn't initially. So I heard it was built for a hostel. Apparently they were going to use it for the nursing, school hostel.
Okay.
But then at some point somebody felt it was. It will make a more useful building if it became a hospital, and they quickly started, trying to retrofit it, and that's how it ended up looking so.
So why didn't the government think about pulling it out completely, just like you did in the case of Umunato? Maybe start from the scratch, and put up something that should be more like that will look more like a hospital, and proper ventilation, electricals, like you talked about, and all that.
Funds.
Okay.
Funds. But first of all, we sent the people from housing to the place, and they came back with a report of how we could walk around the building, and that's what we're trying to do. So we believe that the experts know better. I'm not an expert, so if they feel that we can do something about it, increase the number of windows, open here and there, do something to the building that would increase the ventilation, and then we'll be able to manage it as a general hospital. It's not a specialty hospital as far as we know it. It's a general hospital.
Okay, not more, because that's the name they gave it.
It is a general hospital.
What makes it what's the difference?
So a general hospital is one that anybody can go to.
Okay.
And we only have one in Aba. So there should be one general hospital in every local government. That's the structure for health. And you can't have you cannot not have a general hospital and then you start looking for a specialty hospital. So where do people go to when they need to see the doctor on the next secondary level? Specialists would just pay more attention to specific conditions and address issues that are specific to different areas. But a general hospital looks at, attending to people who the primary health care system could not handle. Right, and that's a big deal for us. So there is a need for us to have that stationed. We'll have that station in all the LGAs. Most of the LGAs have their general hospitals or a cottage hospital. Okay. There has to be a secondary health care level station at the LGA. So for us, that place will be more useful. We have the Abia State Teaching Hospital, which could serve as a specialist hospital, because then you have multiple specialties stationed in that place. So we don't need another specialist hospital when we have Abia State. So whatever we need to do in a specialist hospital, yes,
okay,
we can do it in Absut. And then you go there, you see a gynecologist.
Do you have enough equipment in Absut? Because at some point people were complaining, no equipment and all that.
So Absut has actually received a lot of attention, and it's continued to. So we are going to then improve it to become that center of excellence, where you go to and you have all areas of services provided for. So, we are moving, and we have budgeted, a lot of money for Absut, so we will get to that point where any equipment, it's not about the equipment. There are things, the underlying things that you need to put in place. Who would man the equipment? So you have to engage the trained staff, right? Then you set up the equipment. How would it be managed? Power and the rest of them. So all of that you have to put into place before you land an equipment into a facility. Otherwise, you're going to have a facility with the equipment that that cannot be used. So that's not the kind of administration.
All right. Okay, I know that this time around, when the governor will be marking his 1 year in office, it's expected that he should be commissioning some projects. Are there ones the governor will be commissioning in the health sector, maybe a facility or anything at all, to mark his 1 year in office?
We're hoping the cottage hospital would have been ready but we are still fingers crossed. Hopefully we get there before then and we're able to, you know, bring it on board. Other than that, it would just be shortly after the 1 year in office, then the Cottage Hospital will be reopened again.
Some time ago, I think that was last month, your friends from US, UK, yes, I know you were at the forefront of, you know, you were everywhere talking about that project. I mean, the medical outreach. They came, Abians actually benefited. But the issue is this. I remember when you came on this platform, we talked about sustenance of such projects. You know, some people had surgeries during that intervention project. What is the follow-up like? These people have gone. You know, I asked about this. When these people are gone, who takes care of these patients? And what's the level of sustenance like? Are we going to see more of this in the nearest future? What's the plan of government in this regard?
So, you know, outreaches are not... they're not programs that you will expect to run when a system is functional, if you know what I mean. So it's an additional to whatever that is going on in the system. It's like somebody coming to give you some extra support, right? And which is acceptable. You know, like they said, even they themselves said, even in the US, there are some areas that every now and then you go and do outreaches in those areas and just, you know, buffer whatever it is that the government is already providing for. And that's exactly what happened. You know, they came and, you know, it was a good experience for us. And, you know, the Abians benefited across the 17 LGAs. But you recall that the registration was done through those LGAs, through those facilities. So they believe our plan is to ensure that we also use the same method to continue to, so they know where their hospitals are, they know their doctors, so they know who to approach if they have issues or if they need to do a follow-up. So at some point, you know, they come to the hospital to check in to see how, you know, they check in with the doctors to see how they are doing, if they need to continue to be on the drugs that was given to them, or if they need to get off the drugs. So that is something that we did from the beginning with the intention of making sure that it's sustained as we go on. So, you know, they did a whole lot for us as a state. They did some skills transfer, training, and all of that. And that's some of the trainings we would have to continue, because then we have trained the trainers. Okay. So the plan is for the trainers to continue to train more people and increase the number of people that will be trained in the states. So that's ongoing as well. So, and then every now and then we would have them call in to do e-health consultations, to, you know, do some discussions, sometimes also do, you know, with the COVID, a lot of things are now being done online, and you can learn a lot by just, you know, interacting with people. And that's also relationship that has been established. And, you know, they're also willing to come every now and then, you know, whether in a certain number and in some certain areas, not like the way they did, like everybody coming in. So you may have a group of people, maybe surgeons, or you may have a group of cardiologists, or, you know, different people just coming to just, because we have established this relationship with them. And then recently that connection also, you know, gave us an opportunity to interact with some people from Chicago University who came on a scoping mission to Abia, and the plan is to set up prostate centers in 2 of our institutions, and the pilots would soon start in both institutions. And the idea is to position us to be able to receive grants from the US, whether it's the university, sometimes it's you know, some of them are from Harvard. Those opportunities are, so we have all sorts of opportunities, so that at any point in time you click the Nigerian schools that, you know, that receive funds or grants from the US, you have Abia State as part of that. So that sort of exposes us to a lot of opportunities. So yeah, it was a good one for us, and we are really grateful to His Excellency for the opportunity, because he made it happen. You know, it was not free from our part as government, but it was free to the people. We did a lot of eye surgeries, a lot of fibroid, a lot of hernia. Children benefited a whole lot. You know, about 50-something children benefited from that mission. So lives were changed, families, you know, hopes were turned around, and we can only be grateful that God gave us a governor like, you know, like the one we have in the States, in His Excellency.
So should Abians be looking forward to having this, you know, in the nearest future?
Yes, so there's still an opportunity for us to, the target initially was to do about 500 cataract surgeries, but because of time we were not able to, you know, so we still have the opportunity to do about 200 and something cataract surgeries, and we'll do that across the 3 senatorial zones. So in a couple of months, you know, once we get the approval to roll out, we'll go to the field. So there will be more opportunities like that. And if you recall, we did ours locally when we came on board. Do you recall? Okay. We did free medicals for the Abians, you know, till December. You know, from about July to December, we had people going to the facilities, and you know, it was a very good one for them. It's also restored their hopes in those facilities that where they would normally go to and not find any doctors, or it was either closed down or something. So yeah, there will be more of, you know, sorts, but it will be now structured within the sector. To not be like
embedded in the system.
Embedded. That's the only way you can sustain it, when it's embedded in the system.
Okay.
You know.
All right. If you're just joining us, it is a special edition of the platform. We call it the Scorecard, and it's about the countdown to Governor Alex Otti 1-year anniversary on the saddle here in Abia State. And my guest is the Honorable Commissioner for Health in Abia State, Dr. Ngozi Okoronkwo. My name is Ginika Oloma. We'll take a breather. I was accused of not allowing enough time for you to call in, but let's take a breather now. When we come back, the Honorable Commissioner will talk about some other issues in the health sector. Then we can open the phone lines to allow you to be part of the program. Stay with us. All right, welcome back to the program. It's still the platform, the special edition. We call it the Scorecard. It is about countdown to Governor Alex Otti 1 year in office. And today we are focusing on the health sector. And my guest is the Abia State Commissioner for Health, Dr. Ngozi Okoronkwo. Welcome back to the program, Doctor. Let's have your plans and programs for the Ministry of Health or the health sector in the state. What is it like? I know that when you came on board, you mentioned something like that, and maybe we'll have a review of what the policies are and the ones you've been able to accomplish.
So thank you, Ginika, for that question. For us initially was to we as a government keyed into the universal health coverage theme, which is actually to provide access, to make the healthcare system affordable, to also make sure the quality of healthcare service delivery is of a good quality. So to ensure that everyone in the states would be able to access healthcare around them, they won't have to go too far away from where they live to be able to have access to healthcare. And that was the reason why we decided that at least across the 3 senatorial zones, we'll be able to retrofit at least one secondary healthcare within the first 100 days in office. And also we ensured, in terms of affordability, we started looking at the health insurance scheme to see where we were, and we found out that, you know, the people who were enrolled into the basic healthcare provision funds, utilization was very low. And further scrutiny, you know, we realized that the wrong people were actually captured. So we went back to the field, and we started to look for the vulnerables, the people who were not able to pay, and we captured them, and then we included about 4,000 pensioners into that scheme. we are currently verifying and making sure that they are the right people, and before long we are rolling out to give them access, and we are talking about 50-something thousand people across the 17 LGAs in the state. So in terms of quality, we have actually also looked at the number of human resource for health within the state. We went as low as the primary health care. We started looking at where, the number of people stationed in the various facilities, and we started to, look at the distribution pattern to make sure that we have a certain number of people stationed in the PACs, so that women, when they go for deliveries, they will have at least the basic skilled workers present in those facilities. And we have also engaged over 100 and something MSS people. MSS is midwife, midwives into the system, and we have distributed them across the 7, focusing on the areas where there are less number of skilled workers, and they are doing very well as we speak in those areas. The reports that we have received is that they have actually helped a whole lot in ensuring that that deliveries are made and they're made, that the women are delivered safely. And so this has gone on, and there's still so much more to come on board. And across, of course, we went also back to the secondary level. We started looking at how many doctors are stationed in the general hospitals. We realized that we had a lot of them in the ministry, and we had a meeting, and we agreed that people should go to the service delivery points to increase the number of doctors in those general hospitals, so that also people can, when they go to general hospitals, when we reopen at the points, because they were closed at the time of we resumed, they will have access to the doctors, qualified doctors stationed in those areas, and that we did. And of course, the tertiary institution was not accredited at the time we resumed. So, the main thing for us was to get the accreditation restored, and we did that when we did the renovation and upgraded the hospital a little bit, and we received the five years accreditation, not just 1 year, full accreditation for 5 years. And we have the opportunity to train at least 60 house officers, and also the option to increase the number. And then we have 25% increment in our college intake.
Okay.
So which
doctors?
Yes.
Okay.
So we increased that to about 25%. So I mean, these people had not been, the license had been withdrawn for so long. We had 2 sets of final year students at the time we resumed, and they were not going to graduate if that accreditation was not restored. So they would have been doing like 10 years in a school where the course should have been 6 years. So you can imagine the joy their parents felt. I remember going for their induction, and it was an experience.
So we have enough doctors in the state, or have all of them gone outside the country? Because we need to check this issue of brain drain in the system.
We don't have enough doctors in the state, definitely. So, no state has enough doctors as we speak. None.
Relatively,
no, there is no state in Nigeria, even Lagos, Abuja, nobody has enough doctors. We're all struggling. All of us are struggling.
So you need more doctors.
Yes, we do. So what we are currently doing, we are, they have arrears of about 14 months that have not been paid for. So what we are doing is we are addressing that issue as we speak. We are, talking about it, and it's actually we had a meeting last week with them. We have another meeting this week, and we are in a hurry. We want to quickly address that so that we can. We are also working on increasing the salaries of the doctors. We have actually submitted that document. It's being worked on as I speak too. So we are doing that pari passu. We are working on clearing their arrears, and then we are quickly. So immediately we clear the arrears. The next set of things on top of it will be to increase the salaries of the doctors very quickly.
Okay. So quickly before we open the phone lines, the issue of PTS exam. the one that happened some time ago. They came here, you remember, and I think operations, that exercise was suspended, you know, and what has happened? Has it been resolved? We heard when the issue was on. If it has been resolved, why did we not hear that the issue has been resolved, or you did not follow the due process in resolving it?
We've resolved it.
Okay,
because
so
we resolved it. That's why you didn't hear about it.
we
resolved it, and we took another exam, which we didn't even hear about.
Okay. So why didn't we hear about it?
Because it was done nicely. No, it was done
nicely. Did you follow the due process?
What is due process?
I don't know. Maybe, you know, because, you know, they were here saying that some of them were asked not to participate in the exam.
They were not properly, they were not duly informed.
Okay.
And they have come back to say they were not duly informed. Now they understood what we were trying to do.
Okay.
So before you know that if you get into an institution, the first thing they do usually would be to verify your O levels, and that was not done at the time they were admitted. So that was what we were attempting, because it was a part of the requirement from Nursing Council for us to do that before the pre-qualification exams. So we did that, and you know, there were a lot of misinformation within the system at the time, because it had never been done before. Nobody has taken out time to do that, so they were not really comfortable with that. But eventually we did. They understood what we wanted to do, and they keyed in, and we did it. We have done another PSS after then. So you see, we have resolved the issue.
Okay. You know, because we would have loved to hear.
It has become a normal thing now. So it's not.
Okay, so we don't have issues with it again.
The truth about it, you know, we met a bad situation on ground, and that was our attempt at resolving an issue that was dead prior to our assumption in office. And it wasn't just that, there were just many of them, which I'm sure you're aware of, the racketeering and all of that has been going on. The fact that if you don't pay a certain amount of money, you will not be admitted into the nursing institution or nursing training schools. But all of that, you don't get to hear anymore, because somebody has done something about that. You see that woman selling corn along the road, and she's rejoicing that her child has passed into the training school and she didn't have to pay a dime. That's and now we are going collegiate. We are going collegiate officially, meaning that we would have the opportunity. It's now a college of nursing in Abia State College of Nursing School, and it's now going to go. You now have to go through JAMB to be admitted into the schools, and then you would your certificate will not be a diploma, it will be a HND, and so it's
HND, not degree.
No, it's HND. Well, it's the same as it, because you can go to you can go for youth service from there. So it's a much higher degree and a much better opportunity. We are looking at you know, ensuring that we meet the global standard to the point where when you graduate from our college, you may not have to do a lot of exams when you travel out of the country, because the standard would have been met, you know, with what we are trying to do. So we are, you know, doing assessments, rolling out the committee. Has been working, you know, visiting other colleges, just drawing out information from them, and then, you know, bringing out global approaches to them, and just making sure that what we are going to have would meet the global expectations. So the nursing training school would evolve. It's not going to be the same. It's not going to be like what you are looking at. We're going to have the public health department. We're going to have the psychology department and all of that. So we are expanding. We are going up. Then there's going to be a provost in charge of the colleges. Then we now have the colleges at campuses. You know, the Umuahia campus, the Amacha campus, and all of that. So that's going to
So when are we going to see that happen?
We should be ending in June. So from June upwards, we should go into the JAMB, you know, curriculum to be. All
right, it's time for us to open the phone line, so you can be part of this discussion. I'm sure right now nobody will accuse me of opening up the phone lines late. It's early, so when you're calling, identify your name, go straight to the point. In case you have any question, just fire your question. The Honorable Commissioner is very well competent to handle all the questions where they affect the health sector. and the state. Call us now on 08081826949 or 08116052949. Can also drop your messages on our WhatsApp on 09065108289. Hello? Good morning.
Good morning, Gideon.
Good morning. Welcome.
Good morning, Honorable Commissioner for Health.
Good morning, sir.
Who say man knows this my name? I'm calling from Umai.
Welcome.
Let me congratulate and appreciate our madam that is in the house. For listening to him, I believe that the major reason why she came was down about this 1-year anniversary of the government of today. And assessing what they have achieved in health. So I want to talk about the last question you asked her concerning those students that we are protesting, and nursing students, amateur nursing students. Unfortunately, I'm just hearing for the first time that exam was scheduled and was taken without making it public. I am not just very much happy about it, because most of them are still complaining that they don't know anything regarding in that regard. They have not done anything concerning what they protested in Omaha, what they were going to social media, they were going to radio stations to anger their things that are affecting them. But I don't know whether it is true or not that they've taken exam. Many of them still believe that many of them did not take that there.
Okay.
Then secondly, finally, please, the geopolitical, our governor promised a lot concerning the healthcare system. But I want you people to be more transparent in how much and advertisement of how a project or maybe the construction of a hospital or new hospital or maybe the painting of a new hospital. And I was expecting to hear maybe there's new hospital built in social local government that are supposed to be commissioned, not specialists and other.
Okay. I'm saying, thank you. Thank you so much. I'm sure the Honorable Commissioner will address that. But let's take another call now. Hello, good morning.
Mr. Remain listed.
Thank you so much. Welcome.
Commissioner, you are blessed, and you never know that in life, excellence is my name. I want to contribute to excellently.
All right.
Yes, what he can prepared. That is why he just the people around him are all technocrats and professionals. You can't reach your destination without preparation. What makes you reach is what you earn, but how you manage it. Yes, you can't be into a basket and expect that basket to hold water. And that's why they assembled you. Before, what administration, if there is anything about the health, you see Commissioner for Trade addressing us. If there is something about finance, documentation will come there.
Okay.
They ask him, what is the Commissioner for Health? He said, what Commissioner for Finance? He said, I've called him, how I'm also. He told me what to say. Right. So people will get prepared. So,
thank you, excellent.
Please, those people that came December and 2 months ago, people that benefited, that those we call enemies of their families.
Thank you. Thank you so much, excellent, for your contribution. Let us be brief when we're calling. Hello, good morning.
Good morning.
Speak up. I can't hear you.
Hi, network. How are you?
I'm doing very well. Welcome. What's your name?
I'm calling from Oloko.
Okay, Nzobona, welcome. Go ahead.
Commissioner, good morning.
Good morning, sir.
Look, there's a very big improvement in everything. I'm telling you, I was there in 01. A very big improvement. They are taking care of the Queen for people, and I'm telling you, not to charge them again. All of this not very easy.
Which people are you talking about, Nzobona? Hello?
Thank you.
Okay, I think he was talking about those people you sent in. I mean the diaspora people, that they actually took care of them in the villages. Okay. Welcome. Hello, good morning.
No, good morning.
Good morning, welcome.
Good morning, Honorable Commissioner.
Good morning.
God bless you.
Thank you, sir.
Go ahead. You have been able to spend the achievements and what you are going to achieve in the health sector in Abia State. And I pray God that He will help you people to achieve the good objective you have in hand. It is easier to say theoretically we will do this, we will do that, but practically at the end of the day, nothing comes out of it. One, you've talked about healthcare. Have those people who are workers in the healthcare system, have you been able to pay them all? Because I know some health workers in the primary healthcare who have not been paid since November last year, and who has passed through the verification and all the rest of them. Up to them.
Are they in the employ of Abia State government?
Primary healthcare, not part of the local government system of Abia State.
All right.
I'm talking from experience. Then, when you go to most of the health centers, there are no drugs. There are no drugs. So I hope you provide drugs for this health center so that when people go there, they will access drugs for the treatment. God bless you.
Thank you so much. Let's take another call now. Hello, good morning.
Good morning, Mr. Ginika.
Welcome.
My Honorable Commissioner, good morning, ma.
Good morning.
Thank you, sir. Thank you, ma. I want to contribute. My name is Mr. Chijoke from Bende Road. I want to say that truth is not easy. If you see somebody that tells you the truth, you don't need a prophet to tell you or to confirm it. So what I'm saying is this: Governor Alex Oti, I have been saying it openly. I never come to Abia State to deceive Abians. He has every, a kind of, he has Abians at heart, and that is why we are seeing results. And we cannot continue to talk about past government because they accumulated a lot of problems. Look at in health doctors, they owe them 1 year, close to 2 years. They refuse to pay them, and Governor Alex Oti inherited all these problems, and that is why Abians are very eager to see development in Abia. Thank God for Dr. Alex Oti. I am encouraging you, ma.
Thank you.
Whatever thing you can do in health sector to make sure that Abians benefited very well. I want to encourage you to do that.
Okay. Thank you so much, Chijoke. Well, Honorable Commissioner, I would like you to address the call before the last, when you talked about workers' payments, those ones that are working in the health sector. He said, have you been able to clear all their debts?
So we talked about that already, and that's exactly what we are working on. We are interacting with them. Some of them left, some of them are still around. So we are working, and it's just Abia State University Teaching Hospital, HMB Health Management, the Health Management Board, and a few. I think those are the two. Then College of Health, Aba. So those three are the ones that that are being owed from what we have, information we have, and they are currently being addressed. But above all, like I said, we are working on. We have already submitted our suggestion in terms of increment in salaries, so that is also going to come on board immediately after. So we are not relenting in our promises. We are focused and we are bringing everything on as soon as possible. Regarding the salaries for the primary healthcare people, we understand that some people's verification didn't go through. Some people have challenges and everything. We discussed it recently with the AG, and it's also being addressed. So they are local government staff, but they work for the health sector. So in no time that issue will be addressed. And regarding the drugs, yes, I agree with you completely. Recently, you recall we just passed the Drug Management Agency bill.
Okay.
That was passed by the House, and the idea is to make drugs available, affordable, and actually reduce the availability of fake drugs within the state. And so we are actually working on developing the guidelines, engaging with the wholesalers and distributors and everything. So it's something that the government is aware of, and we're doing something about it. So in no time, we'll start rolling out the plan to ensure that the drugs are available at the facility level. But above all, we are currently actually doing a robust plan for the PAC.
Okay.
We are, from tomorrow, we are rolling out the upgrade of about 27, primary healthcare facilities across the state. They will have solar lights fixed. They will have roofing issues addressed. They'll have borehole, and they will be refenced.
Okay.
And then those facilities will also receive other support just to make it functional. But after then, we have this plan to retrofit and possibly upgrade. I'm looking for a better word.
Okay.
Something state of the art.
Okay.
PAC in 17 LGAs.
Okay.
So this PAC is going to be that kind of PAC you would want to go to. They will have everything in it, everything that needs to be there.
Okay.
So it will be stationed in all 17 LGAs, and that is also coming on board. We would have this before the end of the year.
Okay, so let's go over to our WhatsApp page. Wakwechi Debere said, I am suggesting that you people should be enrolling civil servants to NHIS so that the huge amount of money they pay to private hospitals for childbirth and other health issues can be reduced in Abia State.
I agree.
Are you going to do that?
Yes, we are doing that already. There had been that discussion going on prior to, but people were not being paid salaries. So where were you going to make the deductions from? So now that we have stated that salary payment, then that discussion would resume, and in no time people will be enrolled. But we are also ensuring that the facilities where they would access are ready. You know what I mean? Okay. Yeah, so that they don't go there and those facilities are not ready. So we're doing both at the same time. So
Lizzie from Omar has said, good morning. The registration fee for eye patients at the Cottage Hospital, Aba Road, is high. Can the government reduce the 3,600 naira to 2,000 naira? Most Abians can't afford it. Honorable Commissioner.
I would speak with the CMD of the hospital. Things have actually gone high, and that's why we are looking at insurance. Insurance would help us to address these issues, because when, insurance is like bringing a lot of people together. So bear with us. We would work on that and see how we can make that adjustment. But as soon as the insurance is, properly situated, you won't have any problems with making payments at all. You will just go in and have access to the treatment.
Okay, I think we just have to leave the studio now. You've done a good job, Honorable Commissioner for Health, Abia State, Dr. Ngozi Okoronkwo. Thank you so much for coming on the show. That's 1 year. So going forward, we should be seeing more new things in the health sector. That should be, after this 1 year, the government will be marching on to the 2nd year anniversary. I hope we will see more new things in the health sector going forward.
Oh, there's so much coming on.
Okay.
There's so much coming on. If you recall, the governor also said he wanted to make Abia the tourist center for health in Nigeria. So we are rolling out plans on the medical village that's coming on board. We are looking at the locations and bringing on board some resources to ensure that we give you the state-of-the-art facilities where you have the hospital, the hotels, and everything that you need to access health. So people can come from Maiduguri, people come from Lagos.
When are we going to see this
very soon? Very soon.
Okay, thank you so much, Abia State Honorable Commissioner for Health, Dr. Ngozi Okoronkwo. Thank you. We appreciate you. Thank you. And to all of you, to all of you who called in and who sent in your messages on our WhatsApp page, thank you so much. May God bless you. Sincere thanks to Samson Eze and Eminki Rebu. Don't forget that this program is live on Flow 94.9 FM and All Facts News. Thank you so much, all of you, Thompson, and the guys behind the crew, Charles and Stanko. We appreciate you. Jenny, thank you so much. My name is Ginika Oluwaha. The show returns again tomorrow at 10 a.m. It's still the countdown. We call it the scorecard edition of the platform. Keep praying for Abia State and Nigeria to become great. And I'll see you again. Good morning.